have a tendency to want to help people solve their problems, but there's a power in just listening to an individual describe what's going on with them. And I think this power is undervalued in our society. As a psychologist, I spend a lot of my time just listening to people tell me about their difficulties and conveying a sense to them that I understand or have some understanding of what they're going through. So when I'm doing couples work, I'll sometimes tell the individuals of the couple, don't just do something, stand there. The idea is, don't try to take action or try to solve the problem right away, but be there so the person feels understood, so that they have a sense that you've heard what they've said, you have some concept of what it's like to be in their shoes at the moment, and that you have some sense of what it is that's causing them difficulties. So I often recommend to our practitioners, I'll often tell them, the worst thing you can say to a patient, if a patient is frightened, for example, the worst thing to say to them is you have nothing to be afraid of, because it's often will leave the patient feeling misunderstood and sometimes ashamed about having these feelings of fear. For a cancer patient, it's understandable that they might feel frightened. Many cancer patients do. So to respond and say something like, of course you're frightened, you've never experienced cancer before, or you've had a recurrence. Of course you're frightened, it's understandable. I'm going to do everything that I can for you from a medical point of view to treat your cancer and to do all that we can to help you. And there are other people in our organization who can help you with these distresses that you're experiencing, because they're very understandable and a normal part of the process.